Hello, my name is Dr. Kate Fitzwater. I'm a boarded surgeon here at Brookville Road Animal Hospital, and I work here on Wednesdays. Today I'm going to talk to you about the cranial cruciate ligament in dogs and what happens when it ruptures and what surgery that's most commonly done. So the cranial cruciate ligament is also known as the ACL in people. The diagram here shows us that this is the femur, patella, patellar tendon, tibia, and the cranial cruciate ligament runs from the back of the femur to the front of the tibia. The top of the tibia in dogs is naturally sloped backwards. When the cranial cruciate ligament ruptures, the femur wants to slide down that slope. So it shifts backwards down that slope, and the tibia shifts forwards. When the dog weight bears down, this is termed the tibial thrust, or the instability that the dog feels when they walk. The TPLO is a surgery, and it stands for tibial, plateau, leveling, osteotomy. This is a surgery that I'm going to talk about today, but there are also other surgeries that can be done for the same problem. The TPLO surgery, the goal of it is to eliminate tibial thrust. It is done by first exploring the joint. Inside the joint, we'll be able to determine if the ACL or the cranial cruciate ligament is torn. Also, we look in the joint to determine if your dog has a meniscal tear. The menisci, or the C-shaped fibrocartilages within the joint, same as you or I have in our knee, the meniscus, can get torn in dogs. So if there is a meniscal tear, we will remove the portion of the meniscus that's torn, because a meniscal tear is as painful as this instability that the dog feels. So then the TPLO is done by making a half moon shaped cut in the top of the tibia. Then this plateau that's angled backwards or sloped down like a slide, this portion gets rotated so that it no longer is angled but is flat on top, similar to a table. That's the leveling part of the osteotomy. To stabilize this, we would put a plate and screws on the bone, and this allows the bone to heal in its new location. During this recovery period of 8 weeks, your dog needs to stay on a leash when it's outside. Inside the house needs to be confined to an area where it doesn't run around the house. When you're gone, it's important to keep your dog either in a crate or a small room without furniture to jump on. During this 8 weeks, we are wanting your dog to heal this bone back together. Your dog will start walking on the leg and become less lame from about 2 weeks to 4 weeks. As long as your dog is using the leg well, you can start taking him on short leash walks, about 5 minutes a couple times a day. As long as these leash walks don't cause your dog to become more lame, then they are fine. Here are pre-operative x-rays of Sunshine showing her tibia, femur, and the tibial plateau, or the top of her tibia, as you can see, is angled backwards. This white haze inside shows that she has inflammation and increased joint fluid. Here is a view of her tibia from a cranial caudal view. And then after surgery, we take x-rays to confirm that the osteotomy is in the position that we want. And here is the plate and screws on the tibia. This is the other view showing 3 screws here and 3 screws distal to the osteotomy or cut in the bone. At the end of the 8 weeks, you'll bring your dog back just like Sunshine and have x-rays taken. At that time, we'll determine if the tibia has healed appropriately. About 90% of dogs are healed at 8 weeks and can gradually go back to normal activity over the next 4 weeks. So TPLO recovery is about 3 months. Now we have to talk about complications because there's always the risk of complications with surgery. If you follow the post-op instructions well, we shouldn't have a problem with the implants breaking or failing. But if you allow your dog to run off leash, sometimes the implants can break. Infection is also important to talk about. Infection can happen immediately after surgery if they have any licking of the incision, or late infections can also occur. So years down the road, if your dog ever becomes lame, it is important to bring them back, as we might need to take new x-rays. In some cases, we do have to take the implants out, but it doesn't reverse the surgery. TPLO is one of the most common surgeries that I do. It is because cranial cruciate ligament rupture is one of the most common disease processes. You can bring your dog in for surgical consults with me on Wednesdays. In some cases, we may be able to do the TPLO surgery same day, or we can schedule it at your convenience on a future Wednesday. Once again, my name is Dr. Kate Fitzwater, and as a boarded surgeon, it is my goal to help your veterinarian and you get your dog back to the best health. Thank you very much. Hope you enjoyed the video.